Next heading, that is the cartilage. Okay. So see here cartilage, see again this cartilage, so it is a component of skeletal system, isn't it? So see here, this cartilage, it is also the connective tissue only. So it is the type of connective tissue. Okay. Now see in the Greek, the cartilage is called as, in the Greek name, cartilage is called as chondros. Okay, that is for cartilage. Now see here, if you see the structure of this cartilage, so you will find the cells, you will find the matrix, okay, and you will find the covering also. So see here, the cells present in the cartilage, so they are the chondroblast, chondrocyte, and the chondroclast. Okay, see here. So this chondroblast cell, they can give rise the chondrocyte. Okay, since this chondroblast, they can form the cartilage. Okay, they are cartilage forming cell. So all this fiber, see, you can see the structure of cartilage in this corner here, see in the left side. So this is the histology of cartilage here. Okay, now see here, this all fiber, so this collagen fiber is present in the, or elastin fiber are present, so these all are formed by the chondroblast only. Okay, so this matrix is secreted by the chondroblast only, and the chondrocytes are also formed by the chondroblast only. So chondroblast, they are the cartilage forming cell. Okay, so next type of cell in the cartilage, that is the chondrocyte. So these chondrocytes, they are the mature cartilage cell. So see, the chondrocyte will form the chondroblast forms the chondrocytes. So these chondrocytes, they are present within the cartilage. So these all are the chondrocytes. So they are present in the lacunar space. Okay, so they are the mature cartilage cell. Okay. Chondroblast, they are forming cell. They will form this cell and they will deposit the collagen fiber or elastin fiber or the matrix during the formation of the cartilage. So they are the chondroblast cell. Blast cell means forming cell. Okay. Chondrocyte, they are the mature cell. Okay, they present in the cartilage. Then the next is the chondroclast. So the chondroclast cell, they are cartilage reabsorbing cell. Okay, so like in bone also there was the osteoblast, osteocyte, and the osteoclast, isn't it? This osteoclast, they are the bone reabsorbing or bone remodeling cell. Similarly, they are the cartilage reabsorbing cell. See, if there is the excess formation of the cartilage is there, means they will absorb that cartilage and they will give the proper shape to the cartilage. Okay, so they will maintain the shape of the cartilage. Okay, by observing the excess cartilage. Okay, just remember this thing. So they are the cellular component of the cartilage. Now next is the matrix. So this matrix is formed by the organic and inorganic compound. Okay, so the organic compound, you will find that is the collagen fiber or elastic fiber. So next is the matrix. So this matrix, you will see the organic component and the inorganic component. So the organic component, you will find here, that is the collagen fiber and elastic fiber. So here in case of cartilage, you will find the type 2 collagen fiber. Just remember this thing. Okay, in bone there is type 1 collagen fiber. In cartilage generally you will find the type 2 collagen fiber. Okay, just write here collagen fiber and GEN. Okay, N is missing here below. Then the next is the elastic fiber. So This elastic fiber you will find in elastic cartilage. Collagen fiber you will find in hyaline and the fibrocartilage. Okay, while reading the type you will got to know. Now the next, that is the inorganic component that is formed by the amorphous ground substances. Okay, so these are the matrix component of the cartilage. Now see here, if you see the covering of the cartilage, so in case of bone the covering was the periosteum. Similarly the covering of the cartilage, that is the perichondrium. Okay, so the perichondrium forms the covering of the bone, sorry, cartilage. Periosteum, that is the covering of bone. So here again you will find the outer fibrous layer and inner cellular, that is the chondrogenic cell layer. So these are the two layers in the perichondrium. So outer fibrous layer, okay, that makes give the shape to the cartilage. Okay, then the inner cellular layer, so that consists of the progenitor cell. Okay, these progenitor cells, they give rise to the chondroblast and the chondrocytes. Okay, so they are the chondrogenic cell layer. Okay, now see, if you see the features of the cartilage, see this cartilage, it can resist the high stress and strain. Okay, it can withstand the high stress and strain. Okay, now this cartilage, it has got a property, this elasticity. Okay, so that is the resilient, the ability of, see what will happen, see if you apply the pressure in the cartilage, then what will happen, it will compress. Okay, if you release the pressure, means it will regain its original form again. So that is the resilient, the ability of resilient, or that is the elasticity. Okay, are you getting? So this elasticity nature of the cartilage is due to the presence of one substance, that is the chondroitin sulfate. Okay, so here you can see here, so the cartilage can withstand, okay, it can bear the high stress and strain. Okay, and it also makes the joint flexible also. Okay, flexibility it will give. And next property, that is the elasticity. The property, that is the elasticity. Elasticity means if you apply the pressure, means it will compress. Then again if you release the pressure, means it will again come back into its original shape. Okay, so that is due to the presence of chondroitin sulfate. So that is the ability of that regaining its original shape after releasing of the pressure or stress, that is the resilient, the ability of resilient or the elasticity. Okay, now see the next properties of cartilage. See the cartilage, they does not have got a blood supply, no lymphatic drainage, and no nerve supply. Just you remember this point. Okay, so no, there is no blood supply, no lymphatic drainage, no nerve supply. This is the next property. And the next, see here, so the next property, see next property or next feature you can tell. So this bone, see this cartilage, they forms the base for formation of the bone. Okay, it forms the basis or base for the formation of bone. So see here, yesterday we have seen the cartilaginous bone, isn't it? So while doing the classification of bone, that developmental classification of the bone, there are three types of bone, isn't it? On the basis of mode of formation, that is the membranous bone, cartilaginous bone, and the next is the membranocartilaginous bone. So this cartilage, that forms the base for the formation of cartilaginous bone. Okay, that bone is the cartilaginous bone. That helps in the endochondral. So the cartilaginous bone, see how these bones are formed. See, first from mesenchymal membrane, cartilage is formed, then the cartilage is converted into the bone. Okay, so initially, so in your body, so during the development of the fetus, or there is no bone. Okay, actually there will not be bone. Initially there is the formation of cartilage first, then the cartilage is ossified into the bone. Now what will happen, see, during this stage what will happen, see some of the cartilage they will ossify into the bone and convert into the bone, but the some of the cartilage they will remain as the cartilage for lifelong. So see here, so those cartilage which convert into the bone, they are temporary cartilage. So this temporary cartilage ossify into bone during the development of fetus. Next is the permanent. So this permanent cartilage, it exists as cartilage, okay, throughout the life. See, so initially see, bone they are formed from the this cartilaginous bone, initially they are formed from the cartilage only. Okay, first what will happen, the first tissue, okay, to be formed actually. So this cartilage will form first, okay, and the some of the cartilage they will convert into the bone. So those cartilage which convert into the bone during the development, they are the temporary cartilage, because finally they will form the bone. But some cartilage, see, they will exist as a cartilage throughout the life. Okay, now in your adult body also you can find some cartilage. Okay, so they are the now permanent cartilage. Okay, initially see in the hand region this, okay, in the hand region or in the upper limb, lower limb, okay. So this bone actually initially they are cartilage. Okay, these cartilage are ossified into the bone. Okay, so this initially they were cartilage, so they are the temporary. Now they are converted into the bone. Okay, like that. Just remember this thing. Okay, now the cartilage of the body you can classify into three types: hyaline cartilage, fibrocartilage, and elastic cartilage. So the hyaline cartilage, that is the most abundant cartilage in your body. Okay. Now we'll go for the individual. So hyaline cartilage, see here, so the hyaline cartilage, that is the most abundant cartilage in your body. Okay, so in the most of the place you will find the hyaline cartilage in your body. So see, if you see the color of the cartilage, that is bluish white appearance or a color. Okay, the color of this cartilage, that is the bluish white color. Then if you see the appearance, that is shiny or translucent. Okay, so if you see the structure of the fiber, so you will find here collagen fiber here. Okay, so the fiber they are very thin. So the nature of the collagen fiber, okay, this in case of hyaline cartilage, collagen fiber only. Okay, the nature of collagen fiber, that is very thin and have a same refractive index as that of matrix. Okay, the collagen fiber has got a same refractive index as that of matrix, so it will be invisible. Okay, the fiber will be invisible. Okay, because of same refractive index, the fiber has got a same refractive index that of matrix, so the fiber is less visible here. So the type of fiber present here, that is the collagen fiber only. Then if you see the elasticity of the cartilage, that is flexible, so it is slightly flexible. Now see here, we have to know in which part of the body you will find the hyaline cartilage. Now see example I will give for the hyaline cartilage, where you will find this hyaline cartilage in your body. Now see, most of the articular surface of the bone, they are lined by the hyaline cartilage. Okay, means that is the articular surface of the bone. This articular surface of the bone means the part of the bone that take part in formation of the joints. Okay, you can see here, see in the elbow joint, see here this bluish color here. So these all are the hyaline cartilage only. So here see, wherever the joint is present, okay, in the most of the joint, not in all joint, but most of the joint formed by the long bone. Okay, so here you can see, so they are all the hyaline cartilage. So the articular surface of the long bone, not all joint. Okay, not in all joints. So articular surface of the long bone you will find. Now see, this is in case of adult. Now what will happen? See, you will find the hyaline cartilage in the growing end of the bone also. Okay, so epiphyseal plate. Epiphyseal plate of the growing end. Growing end of the bone or long bone. So epiphyseal plate, that is also the hyaline cartilage. Okay, so now you will not find this bone in the adult. Okay, in case of, you will find in case of children or during the growth. Okay, after adult died, you will not find the epiphyseal plate. Okay, now see here, next you will find this hyaline cartilage in the tracheal ring. Okay, next point, sir, that is the tracheal cartilage. So this in the trachea, if you see, there is a C-shaped cartilage. Okay, that forms the trachea. So that is also the hyaline cartilage. Then you will also find the hyaline cartilage in the larynx, laryngeal. Now, or not all laryngeal cartilage. Okay, so some of the laryngeal cartilage. So they are the thyroid cartilage, arytenoid cartilage, and the cricoid cartilage. They are YTE. Okay. Arytenoid cartilage, thyroid cartilage, and the cricoid cartilage. So these are the hyaline cartilage. Now see here, you will also see the hyaline cartilage. So in the costal cartilage. So the cartilage is, the ribs are joined with the sternum. So here there is the costal cartilage are there. So this costal cartilage, they are also the hyaline cartilage. Costal cartilage. Now again you will see the hyaline cartilage in the nose also. Okay, nose. So in the nose you will find the superior nasal cartilage. So the cartilage of nose. Okay, don't only write nose here. Cartilage of nose. So here the cartilage of nose. Now I will give the name, that is the superior. Here superior means superior. Okay, nasal. Superior nasal cartilage, inferior nasal cartilage, or next name, that is the alar cartilage. So alar cartilage means greater alar and lesser alar. Okay. So alar cartilage, then the septal cartilage. So these are the few examples of the hyaline cartilage present in your body. Okay. Are you getting up here?
Yes, sir.
Just you have to remember the example and the features. That will be sufficient. Okay.
Okay.
Then the next.
Yes.
So next is the fibrocartilage. So see here, fibrocartilage. See, if you see the color of the fibrocartilage, see it is glistening white in color. Then the appearance, that is the opaque. Then if you see the fiber, you will see the numerous white fiber, that is the collagen fiber again. So in case of hyaline cartilage, you will find the few fiber, isn't it? And the fiber, they are having the same refractive index as that of matrix. But here you will find the more collagen fiber, the bundle of collagen fiber you will find here. Okay. And if you see the strength or the flexibility of this fibrocartilage, it is more stronger and firm than the other cartilage. So it is the strongest cartilage. Okay, out of 3. Now see here, you have to know the few examples of this cartilage where they are present in your body. Now see here, you can see here red color cartilage in between the vertebral body. They are fibrocartilage. See here, cartilage present in the between the anterior part of 2 pubic bone. Okay, 2 pubic bone, they are making the joint here in the pubic symphysis. So this is also the fibrocartilage. So now see here, example of fibrocartilage. So the intervertebral disc. So that is the example of fibrocartilage. So you can see this red color cartilage in between the two vertebrae. So they are the intervertebral disc. See, you can see from cervical region to the lumbar region. Okay. So this is the intervertebral disc. Then next is the pubic symphysis. Cartilage of pubic symphysis. Pubic symphysis. Again, see, you will see this fibrocartilage in the glenoid labrum. Glenoid labrum. Okay. Next, you will see this fibrocartilage in the acetabular labrum. Again, you will see this fibrocartilage in the menisci. Okay. Now see this here. See this glenoid labrum. See this glenoid labrum. If you see the scapula bone, okay. So there is the glenoid cavity is there. So this glenoid cavity is lined by the ring-shaped fibrocartilage. So that is the glenoid labrum. Okay. While reading this joint, it will come there. Okay. Then the acetabular labrum, the acetabular cavity. So this is the acetabular cavity is here. So you find this acetabular cavity in the hip bone. Okay. So in this cavity again the cavity is lined by the fibrocartilage there. Okay. So that is the acetabular labrum. Actually, this acetabular labrum increases the size of the cavity. Okay, so it also helps to increase the size of the cavity. Then what will happen? So the hair will fit there. Okay, while reading the joint, you will get to know about this. So glenoid labrum in the glenoid cavity, acetabular labrum in the acetabular cavity. Now the menisci of the knee joint means you will see in this region. See here, red color you can see here in the knee joint. So this menisci actually divides the compartment of the knee joint. Okay, the cavity of knee joint into two compartments. Okay, that is the upper compartment, superior compartment, and the inferior compartment. Okay, so just remember that is again the fibrocartilage. These menisci, they are the C-shaped cartilage. They are the C-shaped fibrocartilage. Just remember now up here. Okay. Then the next.
Okay, sir.
Then the next is the, what is the next cartilage? Next is the elastic cartilage. Now see here elastic cartilage. So the color, that is the yellowish color, the appearance, that is the opaque appearance. Then the fiber, you will find the numerous yellow fiber. The yellow fiber, that is the elastic fiber. Okay, not collagen fiber, elastic fiber. Okay. In the previous two cartilage, there is the collagen fiber. Here is the elastic fiber. See in the below diagram, you can see this. So this is the histology of elastic cartilage. So you can see the elastic fiber here. Okay, remaining above cartilage, you will see the collagen fiber. Okay, so see, so the fibers will be numerous here. Yellow fiber means that is the elastic fiber, white fiber that is the collagen fiber. Just remember this thing. Then if you see the flexibility, this is the most flexible cartilage. See, just you touch your pinna, see the flexibility of the pinna. See, you can compress, isn't it? So it is most flexible cartilage. Now you have to know the example of this cartilage also, where they are present in the body. So the largest elastic cartilage that is present in your body, that is the pinna. Okay. So cartilage of pinna ear, that is the auricle also, same thing. Then you will find this cartilage in the external auditory meatus. Okay, in the cartilaginous part of external auditory tube or meatus or tube, same thing. Then you will find this cartilage in the pharyngotympanic tube also. Okay, pharyngotympanic tube. So this pharyngotympanic tube means auditory tube. Okay, so there is the extension of one tubular structure between the middle ear cavity and the pharynx, the wall of pharynx, or in the nasopharynx. So that is the pharyngotympanic tube. So there is the communication is there, one tube is there. So that is the auditory tube. Or the next name, that is the Eustachian tube. So we are reading the example of the fibrocartilage, isn't it? Or elastic cartilage? Elastic cartilage. Okay. So see, the elastic cartilage you will find in the pinna of the ear. See, this is the largest piece of elastic cartilage, and you will find the elastic cartilage in the external acoustic meatus only. So if you see the external acoustic meatus, it has got a two parts. Okay, the outer cartilaginous part and the inner bony part. So only in the cartilaginous part of the external acoustic meatus also you will find. So here you can see the opening, isn't it? So it leads to the acoustic meatus, external acoustic meatus. So you will find there. Then you will find the in the pharyngotympanic tube or the Eustachian tube or in the auditory tube. So that is the communication between the middle ear cavity and the nasopharynx. Okay. Then the next you will find the elastic cartilage in the, where you will find? You will find the elastic cartilage in the some cartilage of the larynx also. So in the cartilage of larynx, okay, not all, okay. So in some cartilage of larynx, they are also the elastic cartilage. So some are hyaline and some are elastic. Now see, we have seen the hyaline cartilage. They are the thyroid cartilage, arytenoid cartilage, and the cricoid cartilage. So they are the hyaline. Now remaining, see these cartilage, epiglottis, corniculate, and the cuneiform. So they are the elastic cartilage, okay, present in the larynx. Better write some cartilage, okay, some cartilage of larynx. So epiglottis, corniculate, and the cuneiform. Okay, up here. So they are the most flexible cartilage. Then the next, okay. So the next individual bone we have to read, okay. Now first bone we are going to read, that is the clavicle. Okay, now this bone, see, so this is the clavicle. So there is some special features for the clavicle, okay, which is not present in other long bone. Okay, see this clavicle, it is the long bone only, isn't it? Now introduction, you know, I think so. So now in clavicle it is the long bone. So in the long bone also there has got some types are there. So it is the modified long bone. So it is the bone of pectoral girdle. So at least you can write this thing. Okay. So introduction, that is. So it is the long bone, that is the modified long bone, and it is present in the pectoral girdle or the bone of the pectoral girdle. So actually see, this clavicle helps to attach the upper limb with your trunk. So this girdle means, see, this pectoral girdle, it helps in attachment of the upper limb with the trunk. Similarly, in the pelvic girdle, it helps the attachment of the lower limb with the trunk. So this girdle, they are help in attachment of this limb with the trunk. Okay, so anteriorly it is going to help. Posteriorly there is the scapula is there. Okay, now see, so this is the clavicle. Now there are some peculiar features or the special features of the clavicle that we have to write. Now see, so introduction and location, okay. Now some special features or peculiar features. So special features, that means you will not see these features in other long bone. Okay. So this is the only the long bone which is placed horizontally. Okay. Most of the or all of the bone, they are present vertically actually. So this is only the long bone which is placed horizontally. So you can write in sentence. Okay. So long bone placed horizontally. Only the long bone, only one long bone that is placed horizontally. Just you write that. So this is the, see, you can feel the clavicle. So it is subcutaneous throughout the length. Okay, means just below the skin only. See, there is no covering by the muscle. So it is subcutaneous. Of the length. Throughout the length it is subcutaneous. Okay. Then see, it has got the two primary ossification center. It is the first bone to ossify. Okay. First bone to ossify. It has got the two primary ossification center. So generally long bone it has got a one primary ossification center, but it has got the two. Okay. Then the first bone to ossify means the first bone to begin the ossification. Ossification, that is the process of formation of the bone. Okay. So generally you may not see the medullary cavity in the clavicle. Okay. Medullary cavity may not present in the clavicle. So see the next name for this bone. So generally we are considering it as a beauty bone or collar bone. COLLAR, collar bone. Okay. So this is the clavicle. Okay. So these are some features. Okay, for the clavicle. Okay. Now see, if you see the difference in the shape of the clavicle between the male and female. Okay, so there you will find some difference. See, in case of female, this clavicle, so it has got a lightweight. It has got a lightweight, thin. It is shorter. Okay. Then, but in case of male, the clavicle it has got a more weight, so it is slightly heavier and it has got a longer and it is rough, irregular. But in case of female, it is smooth. Okay, so in female, the clavicle is shorter, the surface is smooth, then the weight is lighter. Okay, lightweight. But in case of male, the opposite of this. So if you see the two end of the clavicle in case of female, so I am writing for female only. For male you can write. Okay. Now see, if you see the level of the two end of the clavicle. So in case of female, medial end is above, whereas the lower lateral end is below. Okay. Medial end above and below. But in case of male, if you see the medial and lateral end, they may lie in same level. Okay, if you see the level, in case of female, medial end will be slightly higher than the lower end, the lateral end. But in case of male, they will lie in the same level, or the lateral end lies slightly above than the medial end. Just you remember this thing. Okay. So this is the some difference, sex difference. Okay. Now we'll go for the features or the parts of the clavicle. So location is okay. So it forms the anterior part of the which girdle? That is the bone of the anterior part of the pectoral girdle. So the bone, the long bone which lie horizontally. Okay, and it connects the upper limb to the trunk, and it also transmits the weight of the limb to the sternum actually. Okay. So now we'll see the parts. Now see, if you see the parts of the clavicle, okay, so we can read this part under three headings. Okay, so that is the two ends, that is the medial end, next end is the lateral end, and next is the shaft. So three headings, under three headings we can read. Okay, parts we can read in the three headings. See here, so this portion, so this is one end. So two ends and one cylindrical shaft. Okay, almost cylindrical. Okay, so this is the shaft. So under this headings we can read. Now we'll go for the individual part. Medial end will go, lateral end will go, and the shaft will read. Now see the medial end. See, if you compare the medial end with the lateral end, comparatively medial end is wider and have got a quadrangular in shape. Okay, so the medial end is larger. So medial end, so it is larger. So the next name for the medial end, that is the sternal end. Okay, the next name for the medial end, that is the sternal end. Just I'll write the heading here. So the next name, that is the sternal end. Because see, why sternal end I will tell you. Okay. So we are reading the medial end. So medial end is larger than the lateral end, and the shape of the medial end, that is the quadrangular in shape. That is the quadrangular in shape. So the next name, that is the sternal end. So this end, this medial end, it articulates with the clavicular notch of the manubrium to make the manubriosternal joint. So this end, okay, articulate with the sternal notch of manubrium to form the manubriosternal joint. Okay, to form the manubrio or sternoclavicular joint. Okay, generally we are calling the sternoclavicular joint. Sternoclavicular joint. Generally we are calling the sternoclavicular joint. Okay, or manubriosternal joint. They are not manubriosternal, manubrioclavicular joint. The sternum is different. Manubrioclavicular joint. Okay, for this joint we are calling the sternoclavicular joint. Generally we are calling the sternoclavicular joint. So this medial end, it will articulate with the sternum. See, this is the sternum here. So it is making joint here. So this is the medial end. So the medial end is making the joint with the clavicular notch of the manubrium to make the sternoclavicular joint. Okay, or manubrioclavicular joint. But we are calling generally that is the sternoclavicular. So this is the sternum only, and the sternum, it has got a part. This is the manubrium body and the xiphoid process. So this joint here between the clavicle and the manubrium, this is the sternoclavicular joint. Okay. So this is the medial end. Now if you see the lateral end, so comparatively see, this lateral end, it is thinner. Okay. Thinner end. So it is compressed above downward. Okay. So it is comparatively, it is thinner end. Then see the next name for this end, that is the acromial end. Why acromial end? See here, this lateral end, it articulates with the acromial process of the scapula. So it is the acromial end. So this is here, this acromial, this is coming. So to make the joint here, so this is the acromial end. So comparatively it is thinner. So next name, that is the acromial end. So it articulates with the acromium process of acromial process of scapula. So the name of the joint is the acromioclavicular joint. Acromio joint. Acromioclavicular joint. Okay. So this joint you can see here. So this is the acromial process of the scapula. So this is the lateral end of the clavicle that makes the joint, that is the acromioclavicular joint. Okay. Now we'll go for the shaft. Now that is the shaft. So shaft, this is the middle portion. So this middle cylindrical portion. Now see here again. So if you see the shaft, okay, the shaft, it has got a S-shaped curvature. Okay. So the shaft has got a S-shaped curvature. So see here, the S-shaped curvature is like this. See here, just I will draw here. So this curvature is like this. So suppose this is the medial end, okay? In the medial end, see it's like this. So suppose this is anterior, this is the posterior. Okay, suppose this is the anterior. For my diagram I am writing, okay, not for this bone. So suppose this is the anterior side, this is the posterior side. This is the medial in, this is the lateral in. Okay, now see S shape. So this gives the S shape, isn't it? So now see here. So this shaft, it has got a S shape curvature is there. So see, it has got a two part, isn't it? For S, two part. 1, 2. So see the medial part of the S curvature, S shape curvature. So this is the one part of the curvature, and from here this is the next part of the curvature. So the shaft we can divide into two parts. From here to here one part, and from here to here one part. So this is the medial 2/3. So the medial 2/3 part of the shaft, it has convexity forward. So the anterior convexity. The medial 2/3 of shaft is convex forward, whereas the lateral 1/3 of the shaft is concave forward. The concavity is forward. Now see in this diagram, see in the bone. Now see here. So this is the anterior part of the bone. This is the posterior part of the bone. Now see here, this is the medial part. So see the medial 1/3, it is convex forward, isn't it? Whereas the lateral 1/3, it is concave forward, isn't it? So these are the two division of the shaft here. So we'll divide the shaft into two parts. So this is the medial 2/3. So the medial 2/3 and the lateral 1/3. So shaft, it has got a S shape curvature. Then so that S shape curvature, it has got a medial 2/3 and lateral 1/3. So see here, so this medial 2/3, so it is convex forward, whereas the lateral 1/3 of the shaft, it is concave Are you getting this point? Are you getting? Now we'll see the features in the lateral 1/3 and the features in the medial 1/3. Okay. Let's see for the lateral first. Now see here. So the lateral surface of the shaft, or the lateral part of the shaft, so it has got an anterior concavity, isn't it? So if you see in the lateral 1/3 of the shaft, you will find the two borders and the two surfaces. The two borders are there, and the two surfaces. For the lateral I am telling, okay, for the, now we are reading the lateral 1/3 of the shaft, means this portion of the shaft we are reading. So from here to here, this portion of the shaft we are reading. We are going to see the features in this portion. Then we'll see in the middle. Now it has got two borders and the two surfaces. Now how two borders and the two surfaces? Now see here, suppose this is the clavicle, okay. So if you see the lateral 1/3 of the shaft, it is compressed above downward. That is, it is compressed superior inferiorly. It is compressed. If it is compressed superior inferiorly, what will happen? It is flat, isn't it? So it is the flat part of flat. So that what will happen? It has got an anterior border and the posterior border. Then the surface will be superior and the inferior surface. Okay. So the two borders, they are the anterior border. Then the next border, that is the posterior. The next border, that is the posterior border. So anterior and posterior are that directly here. Anterior and posterior border. So two borders. Then the two surfaces, they are the superior and inferior. Okay, now see here. So see in this part of the shaft here. So anterior border and posterior surface are superior and inferior. Now see here in this diagram. So see, so this is the anterior border. This is the posterior border. Then the next two surfaces, this is the superior surface, next will be below. So this will be, here will be the, here is the inferior surface is here and the superior surface is here. So this is the superior surface. So two surfaces. Okay, are you getting up here? So now see there are some features in the inferior surface. So in the inferior surface you will find the two features you will find, because in the inferior surface there is the attachment of one ligament, that is there is the attachment of one ligament is there that extends between the coracoid process to the clavicle. So coracoclavicular ligament is there. So that is attached in the inferior surface. So see, if you see in the inferior surface, so see this is the inferior surface now. So they have turned the clavicle to see the inferior surface. Now two features you will see in the inferior surface of the lateral 1/3 of the clavicle, that is, so you will see the conoid tubercle and the trapezoid bridge. So you will find these features in the inferior surface of lateral 1/3 of. In the inferior surface of lateral 1/3 you will see the conoid tubercle and the trapezoid ridge. So tubercle, that is the bony elevation, ridge is the linear elevation. So that you know already terminology. So here this is the conoid tubercle, here is the trapezoid ridge. So in this part there is the attachment, in this conoid tubercle and the trapezoid ridge there is the attachment of the coracoclavicular ligament. So this coracoclavicular ligament, it has got a two part, conoid part and the trapezoid part. So the conoid part is attached with the conoid tubercle and the trapezoid part is attached with the trapezoid ridge. Just remember this much. Are you getting up to here? Features. Now we have read the features in the lateral end. Okay, lateral end in the inferior surface you will find the two features, that is the conoid tubercle and the trapezoid ridge. Okay. Now next we will see the now medial 2/3 of the shaft. Now if you see the medial 2/3 of the shaft, so it has got four surfaces. So the medial 2/3 of the shaft you will find the four surfaces. So four surfaces. So these four surfaces, they are superior, inferior, anterior and posterior. So these are the four surfaces. Now you have to know the some features. So superior surface, inferior surface, anterior and the posterior surface. So if you see the inferior surface, so there is some features in the inferior surface. Okay. Now if you see the inferior surface, you will find the two features here. You will find the oval impression and next is the groove you will find. So you will find the oval impression. And next you will find that is the groove. Okay. So see, now see here. So this so this part. Now we are reading the features in this part. So the medial 2/3 part of the shaft we are reading. Okay. Now in this part you will find the four surfaces: anterior surface, posterior surface, superior surface, and the inferior surface. So this is the inferior surface is shown here. So here is the superior surface, here is the posterior surface, anterior surface is facing anteriorly, and inferior surface, now this is the inferior surface. They have turned the clavicle upside down. So now this is the inferior surface. Now see here in the inferior surface you can see the two features. Here is the one oval impression is there, and next one groove is there. So in the middle part, okay, on the medial part you will find the oval impression. On the middle part of the inferior surface, and in the lateral part of the inferior surface you will find the one longitudinal groove. Okay. So the name of this groove, that is the subclavian groove. So in the subclavian groove there is the insertion of subclavius muscle. One muscle is there, subclavian muscle is there. Subclavius muscle is there, that muscle is inserted in this groove. And this oval impression, there is the attachment of the costoclavicular ligament. So this costoclavicular ligament, that is the ligament of sternoclavicular joint. Okay, so there is the interclavicular ligament is there. Okay, so from the first costal cartilage to the oval impression, there is the extension of one ligament. So that is the costoclavicular ligament. Just remember these features. Okay, so these are the features of the clavicle. Are you getting up to here?
Yes, sir.
Okay. Now see, in the superior surface, so you will find the attachment of one muscle. So that is the sternocleidomastoid muscle is there. Okay. In the anterior surface, you will find the attachment of one muscle. So that is the pectoralis major muscle is attached in the anterior surface. Okay. So just remember. Okay. Now I will tell the attachment in the next diagram. Clavicle. Now we'll see this thing. Now see here. So here in the diagram, so you will find some red color. Okay, and the blue color and green color. So this red color generally that is for the site of attachment of the muscles. Okay, this blue color is also for the attachment of the muscles. Okay, so this red color that is for the origin of muscle, and the blue color that is for the insertion of muscles. Okay, it seems like black color, but it should be blue color. Okay, so this blue color, so they are for the insertion of the muscles. Red color that is for origin of muscles. This green color that is for the attachment of the ligament tendons, okay, and joint capsule. Okay, that is for this. Now see here. So the attachments of the muscles we'll see. Now see in the lateral one third of the clavicle. See, if you see, this is the lateral one third of the clavicle. So it has got a concavity, forward concavity. Okay, now see here, the lateral one third of clavicle, it has got two borders, the anterior border and the posterior border. So this is the anterior border and this is the posterior border. So along the anterior border of the lateral one third of the clavicle, there is the origin of deltoid muscle. Okay, are you getting? So the deltoid muscle is originated from the lateral one third on its anterior border, whereas the trapezius muscle, so it is inserted. Okay, inserted in the posterior border of the lateral one third of the clavicle. Okay, so this is the posterior border of the lateral one third. This is the anterior border of the lateral one third. This is the superior surface, and below is the inferior surface. So anterior border, there is the attachment of the deltoid muscle. So that is the origin of deltoid muscle. Posterior border in the lateral one third, there is the insertion of the trapezius muscle. So we are reading the attachments on the clavicle. So lateral one third, anterior border, there is the origin of deltoid muscles. In the posterior border, there is the insertion of trapezius muscle. Okay, you should know this thing. Okay, in exam, so write about the clavicle or write note on the clavicle, like that question may come. So you have to write the features of the clavicle and along with the features, so muscles. So the attachments on the clavicle also you have to write. Now see here, now in the medial two third of the clavicle. So the medial two third of the clavicle, there is the superior surface, inferior surface, anterior and the posterior surface, isn't it? So see here, in the anterior surface of the medial two third of the clavicle, there is the origin of the pectoralis major muscle. So the pectoralis major, that is the muscles in the pectoral region or the chest region, okay, or the breast region. So this is the pectoralis major muscle. So origin is from the anterior surface of medial two third of the clavicle. So medial two third. Then the next here, see in the superior surface in the medial two third. Okay, so there is the origin of the sternocleidomastoid muscle. So actually this is the sternal head of the sternocleidomastoid muscle. We have got a, okay, so this is the sternocleidomastoid muscle in the superior surface of the medial two third. Okay, now next here you see the attachment of the muscles in the inferior surface also. So in the inferior surface, in the medial two-third in the lateral part, so there is a subclavian groove is there, isn't it? In that subclavian groove, there is the insertion of one muscle, that is the subclavius muscle. So this is the insertion of the subclavius muscle. So the subclavius muscle is inserted into the subclavian groove. Okay. Now see here. So now other, you will see here ligaments. Now see here, this is the two ligament is there. So see, this is the conoid tubercle and this is the trapezoid ridge. So in the conoid tubercle, there is the attachment of conoid part of the ligament, whereas in the trapezoid ridge, there is the attachment of the trapezoid part of the ligament. So that name of that ligament, that is the coracoclavicular ligament. So this ligament extends between the coracoid process of the scapula to the inferior surface of the lateral one-third of the clavicle, where there is the conoid tubercle and the trapezoid ridge is there. Okay, so in the conoid tubercle and the trapezoid ridge, you will find the attachment of the conoid and the trapezoid part of the coracoclavicular ligament. Okay, these are the ligament. Now, similarly, in the middle part in the inferior surface, okay, so middle one-third in the inferior surface near the middle end, you will find the attachment of the one ligament, that is the costoclavicular ligament. Okay, so this is the costoclavicular ligament. So the costoclavicular ligament extends between the first costal cartilage to the clavicle. So this ligament, that is the ligament of sternoclavicular joint. Okay, just remember this thing. So the margin on the articular surface of the clavicle, there is the joint capsule is there. So this is the joint capsule. Okay. So this is about the clavicle, the features of the clavicle and the attachments on the clavicle. Okay, you have to write this thing during the exam and you have to draw the diagram also. So these are the diagram for the features of the bone and this is the diagram for the attachments on the clavicle. So these are the four diagrams you have to do in the exam. Now next one I'll go, so that is the scapula. So the scapula, as you already know the scapula, so which type of bone is scapula? So see, scapula, that is the flat bone. Okay, so this flat bone, so it is the bone of pectoral girdle only. So see, this is the scapula. So anteriorly the clavicle attaches the upper limb with the trunk, posteriorly the scapula. So this is the bone of pectoral girdle or the bone of upper limb and it is the flat bone. So this is the introduction. So now next the location. So see the location here. So this is the thoracic cage, isn't it? So it lies in the dorsal aspect and the superior aspect. So it lie on the superior and the dorsal aspect of the thoracic cage. So it lies outside only. See here. So this is the scapula. So location, so it is the bone of pectoral girdle, it lies in the superior lateral aspect on the dorsal wall of the thoracic cage. Okay, so this is the scapula, that is the location of the scapula. Now we'll see the features of the scapula. So this is the flat bone only. Now see, under the following heading, we are going to read the features here. So we'll see the borders, we'll see the surfaces, we'll see the angle, and we'll see the process. Okay, the process means you know already this thing. What do you mean by process? You know already this thing. Okay, while reading the terminology, I have already explained. Now see here, we'll see the border first, then we'll see the surface, then we'll see the angle, and we'll see the process. Now see here, I'll draw the border here. Can you see one border here? So this is the one border. Can you see this, the next border here? So this is the next border. Can you see this border here? So this is the next border. So there are three borders in the scapula. So this is the one border. So this is the superior border. And this is the next border. So this is the medial border. And this is the next border. So this is the lateral border. So the superior border, see, begins from the root of the coracoid process. Okay, and it extends up to the superior angle. So this is the superior border. This superior border, see, in the lateral end you will find one notch. So this is slightly depression is there. So this is the suprascapular notch. So this notch is in the suprascapular notch. So it lies along the lateral side of the superior border of the scapula. So there you will find the depression. So that is the suprascapular notch. Now here you can see this notch. Here slightly depression is here. Okay. So that is the superior border. Now see, this is the medial border. So this medial border, so if you compare with the lateral border, comparatively the medial border is thin border. Okay. So the lateral border, see, this is the thick border, and it lies along the lateral side. See in this diagram here. So this is the medial border. So see, extending between the superior angle to the inferior angle. So this is the medial border, and medial border is thin border, and this border, see, this is the lateral border, this is the thick border extending between the inferior angle to the infraglenoid tubercle. So this tubercle I will explain. Okay, so this is the lateral border. Similarly, there is the superior border extending between the superior angle to the root of the coracoid process. Okay, and in the lateral side of the lateral part of the superior border, there is the notch, that is the suprascapular notch. Just remember this thing. So the border, they are superior border, lateral border, then the medial border. So these are the three borders. Okay, now you can see these three borders. So here the notch is there. This is the suprascapular notch. Just remember this notch. Okay, so this is the superior border, medial border, lateral border. Now we'll see let's see the angle first. Okay, angle we'll see first. Now see here, so you can see one angle is here, the next angle is here, and the next angle is here. So actually this angle, they are the meeting place of two adjacent border. So see here, so see here, this is the superior border is here. Suppose I will draw the outline of superior border. So suppose superior border. So superior border meet with the medial border, and medial border meet with the lateral border, and this lateral border again meet with the superior border. But see, now see here, you will find the three angle here. So one angle is this, one angle is this, and one angle is this. But see, this angle is not acute. So this angle is broad enough. Broad. See here. So this is the angle only. So this just I have extended this line here. Okay. So now see here. So you will find the three angle. So these three angle, they are the superior angle, inferior angle, and the lateral angle. And lateral angle. Now see here. So the superior angle, that is the meeting place of superior border and the medial border. The inferior angle, that is the meeting place of medial border and the lateral border. Whereas the lateral angle, so this lateral angle, that is comparatively, it is not acute angle, so it is the wide. The angle is wide or broad. Okay, and forms the or consist of socket for the head of humerus. That socket, that is the glenoid cavity. So the lateral angle, see, it is not like pointed like this. So the lateral angle, it is comparatively, it is broader angle. So it bears the glenoid cavity. This glenoid cavity, that forms the socket for the head of the humerus. Okay, so here you can see the glenoid cavity. So this is the glenoid cavity only. So can you see? So this is the glenoid cavity. So this is the glenoid cavity. So lateral angle, it is not sharp angle because it is wide due to presence of glenoid cavity, and this glenoid cavity, that forms the socket for the head of humerus. So the head of humerus fit in this socket, okay, to forms the glenohumeral joint, that is the shoulder joint. Just remember this thing. Now see here, in the upper part of the glenoid cavity, so you will find the bony prominence here. So that is the supraglenoid tubercle. So here, bony prominence you will find here. Similarly, in the lower part also you will find the bony prominence, that is the infraglenoid tubercle. So in the, okay, so they are the supraglenoid tubercle and infra tubercle. So the bony prominence in the upper part of the glenoid tubercle or glenoid cavity. So that is the supraglenoid tubercle, and the lower part, that is the infraglenoid tubercle. Now see, the lateral border actually it extends between the infraglenoid tubercle to the inferior angle. Are you getting? So from infraglenoid tubercle to the inferior angle, that is the lateral border, and it is the thick border. Now just you have to remember this tubercle, because in this tubercle there are the attachment of muscles is there. Okay. So this is about the angle. So the lateral angle is wide and it consists of the glenoid cavity. So that cavity it articulates with the head of humerus to form the glenohumeral joint or shoulder joint. Just you have to remember this thing. Now see, if you see the orientation of the glenoid cavity, so this glenoid cavity is facing laterally and slightly forward. So this glenoid cavity so faces laterally and slightly upward also actually. Okay, just remember this thing. So this is about the angle. Now I'll go for the surfaces. Now see, it has got the two surfaces only. The scapula has got the two surfaces only. So the two surfaces are ventral and dorsal surface, or ventral or costal surface. Ventral surface is also known as costal surface too. So the two surfaces, they are the ventral or costal surface. Next is the dorsal surface. These are the two surfaces. Now see here. So in this first diagram, you can see one surface. So this is the one surface. So this is the costal surface or ventral surface. Here you can see the next surface. This is the dorsal surface. Now see, this costal surface is face along the ribs. Okay, so ribs, and see the costal surface bears the fossa here. So slightly depression is there in the costal surface. The depression in the costal surface, that is the subscapular fossa. Okay. So the name of fossa present in the costal surface. So here you can see the depression, isn't it? Not smooth. So there is slight depression is there. So that forms the fossa. So that is the subscapular fossa. So this whole thing is the costal surface. Okay, whole surface is the costal surface or ventral surface. So it is related with the ribs. Okay, so you will find the depression in the costal surface. So this is the depression. So this area is the depression. So that is the subscapular fossa. Okay, now next is the dorsal surface. So this dorsal surface, it faces backward. So this whole surface is the dorsal surface. Now if you see the dorsal surface, it is divided into upper part and the lower part by presence of this structure. So due to the presence of spinous process or spine, so the spine divides the dorsal surface into, or spinous process, spine of scapula divides the surface into superior and inferior part. Now see here, so this whole surface, that is the dorsal surface. Now due to presence of this spine or spinous process of the scapula, so dorsal surface is divided into upper part and the lower part or inferior part. So the upper part, it bears the one fossa, that is the supraspinatus fossa. Similarly in the lower part, so there is the fossa, that is the infraspinatus fossa or infraspinous fossa. So just above the spine, that is the supraspinatus fossa or supraspinous fossa. and just below the spine. So this fossa, this is the infraspinous. So above the spine, that is the supraspinous. Okay, are you getting up to here? So these are about the surfaces. So the ventral surface or the costal surface bears the fossa, that is the subscapular fossa. Whereas the dorsal surface is divided into upper area or upper part and lower part by the due to the presence of spinous process. Okay, so the upper part bears the supraspinous fossa and the lower part there is the infraspinous fossa. Okay, now we'll see the processes. Now what are the processes you will see in the scapula? So process means they are the bony projection, isn't it? So here see, you will find the three processes. So the three processes you will find here, the name of process, that is the spinous process, acromion,
Notice.
you will find the acromion, then you will also find the next, that is the coracoid process. Okay. So next process is the coracoid process. Okay. Now see here. So now this is the spinous process. So this is the spinous process. The next, this is the acromion, and the next process, this is the coracoid process. So this is the coracoid process, this is the acromion, and in the dorsal aspect you will find the spinous process. Now see here, if you see the spinous process, see this is the triangular bony projection in the dorsal surface of the scapula. Okay, extending from the medial border. Okay, the root lies on the medial border of the scapula. So the extending from the medial border. So this is the triangular bony process extending from the medial border of scapula, and it extends upward and laterally. Okay, so this is the spinous process. So it has got a triangular shape. So due to the triangular in shape, so it has got a three border. Okay, so the spinous process now it has got a three border. So the three border are ventral border or anterior border. Then the next border, that is the lateral border. Then the next border, that is the dorsal border or posterior or dorsal or posterior border. Now you can see here the border, you can see here, see, so this is the triangular bony projection actually. See here, so one border is free border, so this is the one border, so this is the one border. Okay, next border is here, and next border is attached along the dorsum of the scapula. So these are the three borders. So this is the dorsal border, posterior border, this is the anterior border. So anterior border, so it is attached border, so it is attached to the dorsum of the scapula. So this is the next is the lateral border. So the lateral border, it forms the boundary of spinoglenoid notch. So there is the notch between the spinous process. So can you see this notch here? So this is the lateral border actually. So this is the lateral border. So the notch between the spine and the glenoid cavity, that is the spinoglenoid notch. Okay. Now see here. So the anterior border, it is attached border. Attached to the dorsum of scapula. The anterior is attached. Now posterior, then the lateral, it forms the boundary of spinoglenoid notch. Forms the boundary of notch. Now next is the posterior border. So this posterior border, so the posterior border, so this posterior border, it is thick border, so it forms the crest. So this is the crest of spine. Okay, so the posterior border thick and forms the crest of spine. So now this crest of spine, so it is thick enough. Now if you see here, see this crest, it has got two lips. So the crest of spine, so it has two lips. This upper margin of the crest, so this is the upper lip, and the lower margin, so this is the lower lip. So the crest, it has got the dorsal border that forms the crest of the spine, and the crest, it has got two lips. So the two lips are the upper lip and the upper lip and the lower lip. So you have to remember this thing, because there is the attachment of muscles in the upper lip and the lower lip, and in the upper lip one muscle is there, in the lower lip the attachment of next muscle. Okay, just while reading the muscle attachment, it will be easy if you remember the part of the bone. So upper lip and the lower lip. Now so this part, so lip is clear for you now. So this is the upper lip, and this below, this is the lower lip. Okay, so this whole thing is the crest of spine. Now you can see here the triangular area, so that is the root of spine. Just remember, so this is the root of spine. So the triangular area near the medial border, okay, from where the spinous process began. So this triangular area, that is the root of spine. So this root of spine is triangular border. So it is bounded by actually upper lip, lower lip, and the medial border. So this triangular area, that is the root of spine. Just remember this thing. That is the label of root of spine. Now next, so border is over for the spine. So posterior, that forms the crest. Anterior, that is the attach. Lateral, that forms the spinoglyph notch. Now the next process, that is the acromion. You can see this bony continuation from the spine. So now spinous process, it will continue laterally and forward. Okay, so this continuation, that is the acromion. Now if you see the acromion, it has got two surfaces and the two border. So the acromion, see, it continue posteriorly with the spinous process only. So they are attached only. Okay. So now it has got two surfaces and the two border. So the two surfaces, they are the superior and inferior surface. Then the two border, they are the medial and lateral border. Now see here, so the two borders, see, can you see this border?
Yes, sir.
So this is the lateral border only, and this border, this is the medial border. So the medial border, it continue with the upper lip of the crest of the spine, whereas the lateral border continue with the lower lip of the crest of the spine. Just you remember, okay? And at the junction of medial and the lateral border, you will find the articular facet for the clavicle. So that facet forms the acromioclavicular joint. So the clavicle will attach here. Like this will be their clavicle. Okay, so the clavicle will be articulating here to form the acromioclavicular joint. Okay, so these are the two border. Now next surface, so superior surface is this, and below will be the inferior surface. So here you can see the inferior surface. So this is the inferior surface of the acromion, and here is the superior surface of the acromion. So superior surface, it is visible here, and similarly below, that is the inferior surface. Okay, surface. So two surfaces and two border. So the medial border continue with the, see, this medial border continue with the superior lip of the crest of spine posteriorly, whereas it continue with the posterior border of lateral 1/3 of the clavicle anteriorly. The lateral border of the acromion continue with the lower lip of the spine of the scapula posteriorly, whereas anteriorly it continue with the anterior border of lateral 1/3 of the clavicle. So what will happen, see? So the muscle attachment will be like this. In the lower border, there is one muscle is attaching like this. So like this, and like this. So one muscle is going to attach like this. So the next muscle from the upper lip, medial border, and the posterior border of the clavicle like this. So this will be trapezius muscle, and the next muscle this will be the deltoid muscle like that. So just remember surfaces and border. It will be easy in reading the muscle attachment. These are the processes. The features okay now? Any confusion in the features?
No, sir.
Now see, so we are reading the muscle attachment on the scapula. Okay, so almost in the muscles on the lateral border, along the lateral border, we have already completed, isn't it? So the along the lateral border on the dorsal aspect, so upper two-thirds, so there is the origin of the teres minor muscle. Okay, by the help of two slips. So these are the two slips, and between the two slips there is the passage of one vessel. There is the circumflex scapular artery is there. Okay, in between the two slips. Now next muscle, so that is the teres major muscles in the lower one third along the lateral border on the dorsal aspect. So this is the teres major. Now we are reading the muscles along the medial border. Okay. Now see in the medial border, you will see the muscles along the dorsal aspect and the ventral aspects both. Okay, in the costal surface and on the dorsal surface. Now see here. So that is the medial border. So in the medial border also, we'll see the muscles in the ventral aspect, and we'll see the muscles along the dorsal aspect. Now see here, in the ventral aspect, so you will see only one muscle. So that muscles, so along the medial border on the ventral aspect, there is the insertion of one muscles. Okay, so that is the insertion of serratus anterior. So you can see this blue color muscle. So this is the insertion only. Okay, so this is the insertion of the serratus anterior. If you see the origin, it is has got an origin from the first to eighth rib. Okay. Now see here only the insertion. So the serratus anterior, it is also known as the buxer's muscle. Okay. So it is helpful in the punching movement. Okay. So remember that is the buxer's muscle. So next, the muscles along the medial border on the dorsal aspect. So you will find three muscles here. So these three muscles, so they are the levator scapulae, rhomboides minor, and the rhomboides major muscle. So on the dorsal aspect, so you will see that again here also insertion only. Okay, so insertion of levator scapulae, levator scapulae, rhomboides minor, and major diagram right here. So rhomboides major and rhomboides minor. Now see here. So see, this is the medial border. Okay, dorsal aspect of the medial border. Now see here, you will see the three muscles. So one muscle from here to here. Let me draw with the different color. Let me draw with the blue color here. So okay. So from here to here. So there is the insertion of one muscle is here. One muscle is inserting here. So next muscle is inserting here in this part of the middle border, and the next muscle from here to here. So this is the three muscles. Now see here. So along the medial border, so in the upper part of the medial border, that is in between the superior angle to the root of spine. So there is the insertion of the levator scapulae. So while writing the insertion of levator scapulae, so you can write like this. See here. So levator scapulae, it is inserted along the dorsal aspect of the medial border. Okay, in between the superior angle and the root of the spine. So this is the insertion of the levator scapulae. So similarly, rhomboides minor, so it is inserted along the dorsal aspect of the medial border at the level of root of spine. So this is the level of the root of spine in the medial border. on the dorsal aspect. Now see, this is the next muscle, so that is the rhomboidus major muscle. So inserted along the medial border on the dorsal aspect between the root of the spine to the inferior angle. So this is the rhomboidus major muscle. So inserting along the medial border. So these are the muscles in the medial border. Now we'll see the muscles in the inferior angle. So in the inferior angle, you will see the insertion of one muscle. So one muscle is taking origin from here. So that is the latissimus dorsi muscle. Okay, so the latissimus dorsi. So that lies on the inferior angle. So here is the latissimus dorsi. Okay, just write the inferior angle and write the latissimus dorsi. So inferior angle. In inferior angle, so there is the origin of the latissimus dorsi muscle. Just remember this thing. Now we'll see in the crest. So this is the crest of the spine. Okay. Now see, this is the acromion. Okay. Now we'll see the muscles in the crest first. So the crest has got the two lips, isn't it? Crest of spine. So it has got the two lips. Though one is the upper lip and the lower lip. So if you see in the upper lip, so this is the crest only, and here is your upper lip. So in this part, so this is the upper lip of the crest. So there is the insertion of one muscle. Okay, so this crest will continue with the medial border of the acromion also. So this is the lower lip. So in the lower lip, so there is one more muscle is there. So this is the lower lip, and this is the attachment of the one more muscle that continue with the lateral border of the acromion. So in the upper lip, you will see the insertion of the trapezius muscle. So upper lip insertion of similarly in the lower lip there is the origin of deltoid muscle. So in the upper lip insertion of the trapezius muscle. So I have made with the blue color. See, this is the site of insertion of the trapezius muscle, and this red. So this is the site of origin of the deltoid muscle. Are you getting up here? Now see, if you see the acromion, so acromion, it has got a two border, isn't it? So this two border, so medial border, then next is the lateral border. So in the medial border, so there is the insertion of the trapezius and lateral border origin of the deltoid, same thing. Because see, this lower lip it continue with the lateral border of the acromion. So from here to lower lip of the acromion, lower lip of the crest of the spine, lateral border of the acromion, including the anterior border of lateral 1/3 of the clavicle. So that this whole part there is the origin of the deltoid muscles. Your clavicle is like this here. If you see the clavicle, okay, your clavicle will be here like this. Now see here, so this is your clavicle. So this is the lateral 1/3 of the clavicle. So along the, so see this muscle, see. So see this deltoid muscle. So lower lip of the crest of the spine, lateral border of the acromion, plus anterior border of the lateral 1/3 of the clavicle. From up to here, there is the origin of the deltoid muscle. Similarly, if you see the trapezius muscle, so this is the trapezius muscle. So from the upper border of the crest of the spine, the medial border of the acromion, then the posterior border of the lateral 1/3 of the clavicle up to here. So this is the insertion of the site of insertion of the trapezius muscle. So it's like this. So acromion, see, lateral border there is the deltoid, medial border there is the trapezius. Just write this thing. So medial border insertion of trapezius, lateral border origin of deltoid. Okay. Now we'll see the glehnate tubercle. So we have got a supraglehnate tubercle and the infraglehnate tubercle. So in the supraglenoid tubercle, there is the attachment of one muscle. So in the infraglenoid tubercle, there is the attachment of one muscle. Now see here. So this is the glenoid cavity. Okay, just below the glenoid cavity, there is the bony prominence, that is the glenoid tubercle. So infraglenoid tubercle. Similarly, just above there is the supraglenoid tubercle. So in the infraglenoid tubercle, you will find the origin of long head of triceps muscle. So in the infraglenoid tubercle, so origin of so triceps means three heads should be there. So one head is from here. Remaining two, medial and lateral head, will be from the humerus. While reading humerus, it will come. Okay, so from the infraglenoid tubercle, origin of the long head of triceps. Similarly, from the supraglenoid tubercle, so there is the origin of long head of biceps. So biceps means having two heads. So one head is from here and next head is from the coracoid process. Okay, are you getting? So in the infraglenoid tubercle, the attached muscle is that is the long head of triceps. There is the origin. So you can see here. So this is the triceps. This is the site of infraglenoid tubercle. So you will find here the triceps muscle origin. Okay, the origin should be with a red color. So here you can see here, so red color. So this is the infraglenoid tubercle. So there is the triceps muscle, a long head of triceps. Okay, here you can see this is the long head of triceps. Similarly, here will be the long head of biceps. Okay, so supraglenoid tubercle, infraglenoid tubercle, two muscles. Now, next there is the coracoid process. So in the coracoid process, two muscles are there. Okay, so the two muscles take the origin from the coracoid process. So in the coracoid process, you will find the origin of so long head of biceps is from the supraglenoid. Now here is the short head of biceps, and also there is the origin of coracobrachialis. 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 Okay, so this is the attachment on the coracoid process. Now you know this coracoid process. See here, so this is the coracoid process. So see, this is the site of attachment of the muscle. So here is the long head of biceps and the coracobrachialis muscle is here. Okay, at least you remember this much. Okay, now other see ligament and capsule. So around the glenoid cavity there is the attachment of the joint capsule of the shoulder joint. Okay, similarly around the articular facet for the clavicle in the acromion process, so there is the attachment of the joint capsule of the acromioclavicular joint. Okay, wherever there is the articular surface, on the margin of that articular surface there will be joint capsule. Just remember this. Now other ligaments, see in the coracoid process there is the attachment of the coracoclavicular ligament. So there is the coracoclavicular ligament, two part, conoid part and the trapezoid part was there, isn't it? So on the coracoid process, attachment of the coracoclavicular ligament. Just you remember this thing. So ligament and capsule, just you can give the name only. So joint capsule along the margin of the glenoid cavity, joint capsule along with the facet on the acromion process. Then the next is the coracoclavicular ligament along the coracoid process. Just you remember this thing. Okay, and if you want to know more, see there is in the coracoid process there is the insertion of the pectoralis minor muscle also. Okay, see this is the pectoralis minor muscle. Okay, up to here. So this is about the scapula.